Okay, welcome everyone. I think we are in good shape to get things underway for the Friday edition of our biweekly COVID-19 media situation report. Thank you so much for joining us today. We've got a great turnout from many of our elected officials. I see MP Mary Monsef with us and MPP Dave Smith, County Warden Jones and Mayor Diane Therrien, and we're also very pleased to have Chief Scott Gilbert with us from the Peterborough Police Service. So to get us underway, I will begin with a land acknowledgement, and I would just like to say that we respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. So with that, I will invite Board Chair Mayor Andy Mitchell to start us off with some opening remarks. Please go ahead, Andy.
Thank you, Brittany. This past week continues to see a decrease in the number of new cases. Our residents' willingness to stay at home, to travel only for essential purposes, and to abide by public health guidelines is making a difference. Thank you to everyone for your efforts. Despite the progress, there are some days I suspect that many of us feel weary and frustrated about the many things we cannot do. Despite the necessary limitations, it is important to hold on and continue to celebrate what is fundamental to each of us. Even though we may need to do some things differently, seeking to fulfill our dreams and nourishing our souls should always be a core part of our daily lives. Each and every person is so profoundly important. There are days when the weariness seems overwhelming, and I wish, like a bad dream, that we could just wake up. And then I remember my father and mother, and the thousands of their generation who lived through a Great Depression and then went on to fight a world war. Dreams and hopes deferred for 15 years. And I know that despite all, we will prevail. Every day I see the sacrifices made by residents of our area to keep us, our families, and our communities safe. And I am eternally grateful to everyone. We will endure, we will build back better, and we will hold each other close again. Stay safe, be well, and in all things, be kind. Thank you.
Thank you, Mayor Mitchell. Okay, so we now have our situation report presented to us by Dr. Salvatierra, our Medical Officer of Health. Please go ahead, Dr. Salvatierra.
Thanks, Brittany. As of 4:30 p.m. yesterday, there are currently 31 active cases, which are 2 less than we had on Tuesday, and 19 less than last Friday. I would like to correct the record from Tuesday to note that we did in fact receive 1 case on Monday, and it came in around 11:30 p.m., so just before midnight, and it wasn't caught in time for our Tuesday morning briefing. You'll note in the tracker that there are actually 2 cases reported for Monday. One is a duplicate, and it will be merged with the original record. So unfortunately, we did not enjoy a case-free day on February 1st after all, but we are getting closer with lower daily case counts. In total, you'll see that we've reported 556 cases since the pandemic began, and my team is now following 64 high-risk contacts. Sadly, our community lost another life to COVID-19 as we are now reporting 9 local deaths since the pandemic began. My sincere condolences to the family and loved ones. Next slide, please. This bar graph shows our weekly totals continuing to decline, and that is a very good sign. This week's pace of new cases is lower than last week. We stand at 11 cases so far this week, compared to last Friday when we were at 21 cases for the week. So that's a very good sign. If we look at our epi curve, you'll also see here that the curve is becoming flatter as the number of new cases continues to decrease. For exposures, they remain consistent with the same breakdown of just over 2/3 of our cases being being close contacts, and just under a quarter from community spread where we cannot identify the source of acquisition. You'll see the remainder are from travel. For our next slide, our active outbreaks, we currently have 2, one less than Tuesday because the outbreak at Regency Retirement Home has been declared over. So I will share a brief update on the COVID-19 variants of concern. Public Health Ontario has announced that starting February 3rd, all positive COVID samples will be screened for the variants of concern. They've also released a preliminary result of their point prevalence study that screened all samples in Ontario that were taken on January the 20th. And of the 1,880 positive samples analyzed so far, they found variants in 103 cases for a rate of just over 5%. None of these were from Peterborough area. With more Moderna vaccine arriving soon, our vaccination rollout is ready to resume. We completed vaccinating all the residents of the Springdale Country Manor long-term care home in Cavan Monaghan on Tuesday. That leaves residents in 3 local long-term care homes who would still require their first dose, and we expect to complete that by the new provincial deadline of February 10th. Today, I would also like to follow up on the topic of local drug-related poisonings in our community that was touched upon last Tuesday. As we all know, the poisoning of the illicit drug supply is another major public health crisis that is affecting our community in many ways. Together with our partners, we remain committed to providing up-to-date evidence-based information surrounding drug-related harms while protecting the privacy of the individuals and families impacted by substance use. Given the significant stigma that is often experienced by people who use substances, we are sensitive to how the release of information can impact those individuals and their loved ones. We aim to maintain respect when discussing local substance use. It's key to remember that behind the statistics and the opinions, there are people. People who are someone's mom, someone's friend, and someone's loved one. When there is a clear need to protect health and prevent harm related to substance use, we release information to promote awareness and support people who use drugs in making informed decisions around their use. This is well evidenced by release of alerts through our early warning and surveillance system. So the issue of privacy comes up in regards to other issues like COVID. As a health information custodian, I am required by the Personal Health Information Protection Act to balance the release of information while protecting the personal health information of our community members. Peterborough Public Health applies these standards in assessing media requests to ensure that they align with our legislated responsibilities. Due to the smaller size of the population in Peterborough County and City, in comparison with other regions, we apply a high standard in protecting the privacy of individuals. As someone who came here from Toronto, I certainly appreciate the differences, but over the past 13 years, I have acquired a deeper appreciation for the measures that we need in smaller communities like ours to protect privacy. I appreciate too that media and residents are keen to understand how the opioid crisis is unfolding in our community and what it actually means to real people and real families. We've learned how effective this type of media briefing can be in keeping everyone informed. Plans are now underway to develop a similar kind of communication structure that will help educate the community on the complexities of substance use, and that will include the release of substance-related data. So please stay tuned. I believe Chief Gilbert from the Peterborough Police is on the call as well today. So I wonder, Chief Gilbert, if you have anything to add on this topic?
Thank you, Doctor. What I want to say, though, is that not all of these suspected overdose deaths that we've seen over the last few years are immediately determined to be overdose deaths. They take time. We require extensive examinations by the Center of Forensic Sciences as well as the coroner's office to actually make a determination what the cause of death turned out to be. And in some cases, the cause of death actually was ruled to be natural causes, although initially suspected to be an overdose. Added to that, what sometimes is suspected to be an opioid overdose turns out to be something else entirely, a combination of perhaps prescription drugs and alcohol or some other mechanism. So we do, in conjunction with public health, want to be as accurate as possible with the information that we release. And we certainly don't want to be releasing inaccurate information that misleads friends and family as to what the actual cause of a person's passing turns out to be. And as you said, Doctor, we certainly don't want to stigmatize people in the community by providing inaccurate information.
Great, thank you. Thank you very much for that. And so I will now invite Brittany to share an update on a new study that we are undertaking with Trent University. So over to you, Brittany. Sorry, Brittany, I think you're mute. You're on mute.
There we go. How's that?
Much better.
I hope my spotlight worked as well, but you can let me know. Okay, so good afternoon, everyone. And as you may have heard yesterday, we announced a new study that we are conducting in partnership with Trent University, and it is to explore local attitudes and perceptions around the COVID vaccines. Our goal is to better understand what kinds of information people want to know about the vaccines and what their concerns are so that we can support them in making an informed decision about getting vaccinated. This will certainly help us in designing more effective promotional campaigns and to build confidence in the vaccine when mass immunization clinics prepare to launch this spring. So COVID-19 vaccines are entirely voluntary, so it'll be ultimately a personal choice for every eligible resident. There's a lot of information out there about vaccines, so I think it's understandable that some people are confused and they're not sure how to tell what's credible information or not. So we hope to test some of these assumptions and find out what questions and concerns people have so that our messaging can be as clear and as helpful as possible. So our key message right now is that we are looking for focus group participants. We're encouraging anyone who lives in the Peterborough City County area or in Hiawatha or Curve Lake First Nations who are over the age of 18 to register on our website. There's a survey link there where they can express their interest in taking part in these. And this study is completely voluntary and people can drop out at any time. So far, we've had 45 people sign up to participate, and we're hoping for at least twice that amount so that we can have a number of focus groups of about 5 to 6 people. So many thanks to our media partners who've already helped us get the word out, and we appreciate your support as we can, in continuing to amplify this over the coming week. So with that, I am now going to invite our local elected officials to share their comments today. And we will begin with MP Miriam Monsef. So please take it away, Miriam.
Thank you so much, Brittany. Hello, everybody. Bonjour, Anin. Salam alaikum. I'm on Mississauga territory in my home and really appreciate the important work that public health and frontline workers are doing, and of course, all the elected leaders on this call. Our community is better off because of you. I will focus my remarks today on vaccine and what is next for us, as well as give a quick update about travel and speak about the thoughtful idea that our Chief Medical Officer of Health put forward around better communicating and mobilizing to address the opioids crisis in our community, even as we fight COVID. So let me begin with, first of all, recognizing that the many ups and downs of the past year have taken a toll on so many, no one more than those on the front lines of this work and those who are grieving the loss of loved ones. Despite the many ups and downs behind us, Canada is on track to receive 6 million doses of safe vaccines next month. And come September, every Canadian who wants one will get the vaccine for free. Our challenges coming up will be ensuring that those who administer the vaccines have the capacity and the supports to do that. The government of Canada has invested 8 out of $10 of COVID response, and we will be there to support our partners, including the provinces, with whatever they need every step of the way. The other challenge that we can expect is some vaccine hesitancy, which is why the community-based research you're working on, Brittany, is so important. And I congratulate Trent and all the partners involved for taking a lead on this. That will be another hurdle for us to cross. On travel restrictions, please, if it's for non-essential reasons, stay home. It's not worth it. All international flights are limited to 4 airports: Vancouver, Calgary, Toronto, and Montreal. All Mexican and Caribbean flights are suspended until the end of April, and we thank the airlines sector for voluntarily doing so. There is mandatory PCR testing at airports, coming at airports, and the mandatory 14-day quarantine will remain in place. And I will follow up in the near future on more border measures. On opioids, as we battle COVID, the other public health crisis we were experiencing in our beloved community didn't go away. The isolation measures and the mental health toll that the pandemic is taking is hurting those who were hurting before COVID even more. Federally, we've been able to support 13 local jobs through the Mobile Strategic Overdose Response Team and the Elizabeth Fry's peer-to-peer harm reduction program, who provide 24/7 outreach and support services. The application for the consumption treatment site has been submitted to the province, and a project like this, of course, is only feasible if it has that funding in place. Once the province has committed to funding the site. Health Canada can vet the overall viability of the project so that we can do the due diligence and provide the required exemption. And I want you to know that I will do everything I can to show up to the calls that you convene, Dr. Salvatera, and that I'll continue to do everything I can with my team to ensure that those who need the help in our community receive it. Housing is most certainly part of that. Earlier today, I announced federal support to build another 27 units of housing here in Peterborough. Federal supports to date to renovate, to subsidize, and to build housing has supported some 1,600 units here in Peterborough, Kawartha. We will be getting the 2020 numbers soon, and I look forward to updating our community on that progress. Housing is a challenge in our community, but it is also a solution to many deeply rooted challenges we experience. And only if every order of government is at the table and rowing in the same direction, we will be able to solve this. And I thank my colleagues, particularly those in the city, for the work that they're doing to expedite this process so that everybody has a place to call home. That's it for me, Brittany. Thank you.
Thank you very much, Miriam, for those federal updates. So now to offer us some updates on the provincial side of things, I'd like to invite MPP Dave Smith.
Thank you very much, Brittany. I'll keep my comments very short. My internet seems to be dipping in and out. I've dropped off a number of times. We have the ability right now of vaccinating 40,000 people a day. This past week, we received 26,000 vaccines in total in the entire province. Next week, we'll receive 27,000 vaccines. So our capacity to deliver the vaccine to individuals far exceeds what we're receiving right now in vaccines. And I'd like to really impress upon our federal member right now, do everything possible to get more vaccines for us, because we have the ability to put them in people's arms. We just need to have them here in Ontario in order to do it. We've also been working on mass vaccine plans so that we can roll it out to everybody as soon as we have enough vaccines in the province to do so. Last week, or Tuesday, I guess it was, Dr. Salvatera mentioned looking for volunteers for the mass vaccination here in this area when we're able to do it. And my office has reached out to people as well to get people to volunteer for it. We're referring to it as Operation Inoculation. And I think that knowing how our community has always stepped up to help when asked, we should have an entire army of people ready to help, whether they are retired doctors and nurses who can help do the vaccination themselves, or whether it is just the average person who's there to help with registration, to help with the logistics of moving people in and out, or whatever it may be. I know our community is going to step up and do what's right, because that's what our community has always done. Thank you.
Thank you very much, MPP Smith, and thank you for your help in volunteer recruitment. That's such important work right now. So I will now invite County Warden Jones, if he has some remarks to share. Please go ahead.
Okay, thank you very much, and it's a pleasure again to be here with everyone. I want to thank everyone for what they're doing. Miriam and Dave, I know you're working around the clock to everything you can. We do appreciate it. We at the county and our 8 townships are certainly doing everything we can do to get the word out about stay home and stay safe and all those great things. I'm delighted to hear Dave talk about the volunteer efforts to get these inoculations done in a timely manner. I know for a fact that we have many retired RNs, etc., throughout the county who would be delighted to offer their expertise. So I think we all need to maybe jump in and get that list as big as we can. Anyway, things are rolling along. I'm coming to you from beautiful downtown Warsaw as I stay home. I know many of you are as well, but the county is doing quite nicely. A lot of staff are working from home. I still like to salute our paramedics and our public works people. They're out there because they have to be out there. They're on the front lines. and we should never forget the efforts they're going through. We'll get through this. We've got a great community. I thank Miriam and I thank Dave for having consistent communication methods that we can all talk and get together. So, sometimes you got to bury all this politics stuff and just remember we're all people. We're all trying to work together. Bottom line is it's going to be a real shot in the arm. So thank you, everyone. Let's keep smiling.
Thank you very much for another upbeat message, County Warden Jones. Okay, now I'd like to turn it over to Mayor Diane Therrien. If you've got some comments for us, please go ahead.
Thank you very much, Brittany. So on opioids, I've been hearing from many community members about this crisis and the need for action. And we've seen through this pandemic that governments can be nimble and can make changes to policy and get things done quickly when the situation is urgent. So I think the same urgency needs to be applied to the opioid and addictions crisis, which is also, as we know, getting worse as the pandemic goes on. So all levels of government need to be working together to save lives, just as we've been doing with COVID, and we're losing more people to opioids than we have been to COVID. So we need to be working together on that front. With regards to COVID at the city level, we're waiting on confirmation about whether the stay-at-home order will be lifted or extended, and so planning for a variety of scenarios and how city services will be impacted. And once we have those details, we'll certainly share them through this session as well as online and other media sources. It's already been said by those on the call. Whatever happens with the regulations, we need to keep adhering to our public health guidelines and limit outings, physically distance, all those best practices. Wash your hands, be smart, and be kind. So that's it for me. Thank you.
Wonderful. Thank you very much, Mayor Therrien. Okay, so now it's our media colleagues' turn. So I'll start with Paul Rellinger from Kawartha Now. If you've got some questions for Dr. Salvatierra, please go right ahead.
I do, Brittany, and thank you so much again for this opportunity. I had a couple things for Dr. Salvatierra. What homes, can you clarify what homes are left to visit for vaccination?
I don't have that list with me today, Paul. We can certainly get that to you after the media scrum.
No worries. I was just trying to get you to do my work for me. So, so I can probably figure it out. But I thought you might have had it on the tip of your tongue.
No, I don't.
In regards to the unfortunate death that was reported this week, again, any details? Male, female, congregate setting, private residence?
No, I'm afraid not. I don't have any information on the death. It hasn't been shared with me, so I'm unable to provide anything right now.
Okay. And sorry, I'm just swinging back to vaccination. Has that? I was trying to figure it out in my head. I think you said last meeting, but has that vaccine arrived or is it pending?
It's pending. We are expecting it to arrive, so we know that it's in the process of being transported.
Okay, great. And one more thing, Dr. Salvatierra, if I could. We haven't seen numbers weekly this low since about early November. If you go back over the chart, across Ontario, they're coming down, fingers crossed, and they've been coming down here steadily as well. I just wanted to get a couple thoughts from you about you come on here twice a week, and your public health staff and all our local politicians, municipal leaders, telling people to stay at home, hammering home that message. These numbers, what are your thoughts just in terms of how these numbers validate all that? Because many people throw their arms up in the air and say, it's not going to make a difference, but it clearly is.
It clearly is. You're correct. Right now, we are back to yellow as far as that stay-at-home framework that we were using. So our incidence rate has declined steadily, as has our percent positivity rate, our reproductive number. Everything is trending down. And as I've said earlier, what we've really noticed is that for each case that we do get, we're getting a smaller number of high-risk contacts. So it makes it more manageable for us. And I can't emphasize how important it is, because we're also now trying to ramp up vaccine rollout, and it's the same people. So the nurses that, that are currently doing case and contact management, we can redeploy them as immunizers. So the better controlled our outbreak is here in Peterborough, the more capacity Peterborough Public Health will have to address a vaccine rollout. So it is making a difference. The staying at home, the reduction in socialization, and as well, the other piece that's important is getting tested. If people don't get tested, we won't know that they're a case. And if we don't know they're a case, we won't be able to get in touch with their contacts and advise them and have them isolate as well. If you remember, the greatest risk for us for COVID right now is through close contacts. So the better we are at having people test early, the better we're going to be at locking down that infection and preventing that transmission further. So I think the community is doing a great job, and I'm really counting on everyone to continue in order to keep this under control, especially with the threat of the variants now. They are such a game changer that we need to make sure we don't have those variants circulating here in Peterborough.
Great, Dr. Salvatore, thank you. And I did have a question, Brittany, if I could, for Chief Gilbert, if he's still on the line.
I believe he is.
Sorry. Yeah, Chief Gilbert, I just wanted to get any word from you if there's been any recent ticketing or fine activity. I know there was the protest, I think it was about a week ago or so, where not a bunch, but a few tickets and fines were given. But has it been pretty quiet on that front as of late, to your knowledge?
It has been. I haven't been notified of any new charges, and certainly the demonstration that we had last weekend, there was no charges laid in relation to the protesters that were outside City Hall.
Oh, okay. All right. I misunderstood. I thought, were some people fined at that protest, though? Or?
The previous week they were, but not this past Saturday. They were complying with local health guidelines. Okay,
great. Thank you, Chief, for that clarification. And also, if I could, for Miriam Monsef, one question, or a request. Miriam, MPP Smith had said in his comments and brought up a concern with the delivery of vaccines and how there are boots on the ground but no vaccines. Could you just provide a response to that, to what he was pointing out in his concern? And as you know, Miriam, I mean, there's been a lot of talk, and I'm not saying it's the correct talk, but there's been talk about the rollout in Canada, if it's slow or if it's been held up and people are frustrated. So maybe you could just speak to, again, if you could, what MPP Smith was commenting on.
Well, I would ask MPP Smith to comment on it, but I will tell you this: if people are frustrated that we're still in lockdown, that funerals can't be attended, that weddings got canceled, that people's lives are on hold, and so many lives have been lost to COVID, that's all valid, and we all share that frustration. I sit on the cabinet COVID committee, and we meet in the mornings, we meet in the afternoons, we meet in the evenings. And I can tell you with great confidence that Canada's going to be okay. Canadians are going to be okay. We have procured 10 doses per Canadian, and any Canadian who wants one will receive a vaccine by September. The supply of vaccines, the instability in that supply, come next month, and today is, we're going through the first week of February. Come March, Canada is going to receive 6 million doses, and then more and more throughout the upcoming months until we get to September, and every Canadian who wants it gets the vaccine. These are difficult times to be sure, but this community can rest assured and Canadians can rest assured that we're going to do everything we can to make sure that Canadians are healthy and safe, and that we get those vaccines in those arms. It's a matter of, health and safety, but it's also the only way to get our economy back and start to build back better. So we are seized with it, we are on it, and we're going to be okay.
Thank you, MPP Monsef and everybody else. That's it for me, Brittany.
Okay, great. Thank you very much, Paul. Okay, so now I will turn it over to Taylor Clydesdale from Peterborough this week. And if you have some questions for Dr. Salvatierra, please go right ahead.
Thank you, Brittany. For either Dr. Salvatierra or yourself, Brittany, actually, just in regards to this focus group with Trent University, I'm just wondering, is there anything that you're hoping to find or any hypothesis that you have kind of going into this study in terms of vaccine hesitancy?
I don't mind answering that. Well, we just, we assume that there's misinformation out there, and we also assume that the way the narrative is unfolded around vaccines, with there being so much chatter on social media, that it's led to some confusion. So we want to dig a little deeper and understand exactly what people are finding confusing and where they are seeking information, so that we can better tailor our communications programs to support the needs of our residents and making an informed decision.
Okay, and just in terms of, if you do find that there is kind of a portion of our population in Peterborough who reads vaccine misinformation or disinformation and has adopted the belief that the COVID-19 vaccine isn't safe, how do you go about changing their minds?
Well, I mean, communications is, the activity that can only really convey key messages, and we can gauge whether or not they've been received accurately enough. When you move down the health promotion spectrum of trying to change behaviors, I'd be relying on my health promotion colleagues who are experts in that to help guide some of that work. But there's, I think, lots of opportunities in the way we have many communication channels available to us. We could, produce videos that help people have those conversations about COVID vaccine and learning how to, understand differences of opinion. And I think what we'll find out through this is, maybe there's certain segments of the population that access certain media that we need to really focus on in giving information that they need, because they're confused about certain parts of the vaccine. So yeah, there's lots to learn. So we're sort of just wanting to absorb as much as we can, so then we can analyze the best steps going forward.
Just in terms of vaccinations of long-term care homes, I know not every dose that has gone to a home has gone towards residents. There are some cases where someone has been unable to get the COVID vaccine, but have there been cases witnessed where someone has said that they don't want the vaccine because they don't know what's in it, or they have these certain beliefs about the COVID vaccine, or they feel unsure about it?
Not that I'm aware of, Taylor. And what we would like to do shortly is actually, in retrospect, give the community a sense of what percentage of that population actually was immunized. So what was the vaccine acceptance rate? Was it 90%? Was it 95%? So that is something that we would like to add to our weekly reporting on our immunizations, and then that will give you some of the answers that you're looking for.
For sure. Dr. Salvatore, is there anything else that you want to add in regards to kind of the vaccine hesitancy, or just, misinformation is probably one of the biggest things that we deal with in terms of media and trying to kind of correct the record. I'm sure that a lot of resources of the health unit goes towards that as well.
Yeah, I think we've certainly been asking people, finding out what their questions are and trying to address those as early as possible. Like I've already done vaccine information sessions with Curve Lake and with Hiawatha. We did one for the whole community. And every time we do it, we ask people to tell us what are their questions, what are their concerns. Sometimes it is misinformation. Sometimes, I mean, I must, with the new messenger RNA vaccines, it's a whole new technology. And so people need to understand how these vaccines work compared to the older ways that vaccines worked in the past. I think we also want to make sure that people are fully informed and have as much information about potential side effects, what we do and don't know about those. So we've been trying to update that as more information comes available, because both with the Moderna and with the Pfizer vaccine, we now have had millions and millions of doses administered throughout the world. So we are accumulating better safety data that we'd like to share with our communities. And I think also then people, sometimes what I find is people want to know, like, is this vaccine the best for me, given my, my age, my illness, my risks? So sometimes it's a matter of having that kind of very personal conversation with people who are trying to sort through whether or not this is a good decision for them. So that's all. Vaccine education that we've already begun here, and we certainly are committed to keep that going. Whenever we have a new vaccine authorized for use in Canada, and hopefully we will have the AstraZeneca soon, we will do the same. We will get out in front of it, and we will share as much of the information that we have so that people can understand it and start making those personal health choices.
All right, perfect. I think that's it for me today. Thank you so much.
Okay, thank you very much, Taylor. Okay, Matt Latour from Oldies and Freak Radio. If you've got some questions for Dr. Salvatore, please go right ahead.
Are you there, Matt?
Maybe he had to step off. I'm just looking to see if I see him on the list. Oh, I don't think I see him now. Okay. I guess he's had to step off. Okay, that brings us to Jessica Niznik from Global. If you've got some questions for Dr. Salvatore, please go ahead, Jessica.
Thank you. Forgive me if you've already mentioned this, Dr. Salvatore. I had some technical difficulties on my end, so I missed a bit. Did you say how many staff were vaccinated at Springdale?
No, I wasn't asked, and I didn't say, and I would have to look it up because I don't have the total.
Okay,
would you like us to look into that for you, Jessica?
If you wouldn't mind, thank you.
Okay.
And then that was really, any word on when, so we're still hoping to get Moderna this weekend. Any update on when Pfizer might arrive?
We've been told, I'm just looking at my calendar here, the last week in February. And so we are hoping that that in fact comes true, because as you know, things have been changing very rapidly, but we are beginning to plan for that. So we're hoping that that last week of February, we will be able to be immunizing with the Pfizer vaccine here in Peterborough.
Thank you. And so next it would be the healthcare workers then, because after this week, you'll have all the residents done. So then you'll move on to long-term care staff and caregivers?
That's correct, as well as I know that we've got very high priority hospital healthcare workers, as well as our paramedics, our first responders, who are also high on the list for people that we would like to be able to immunize soon.
Great, that's it for me. Thank you, Dr. Salvatore.
You're welcome.
Great, thank you. Well, I think that is it for all of our media colleagues, and I've taken note of those follow-up questions for Paul and Jessica, so I will be back in touch with you through email on those. Thank you again to our elected officials for joining us today, and we will see you back here on Tuesday. Okay, have a great weekend, everyone.
Thanks,
you.
everyone. Have a good weekend.
Thank you.
Thank you. Stay safe.